everybody, it's Dr. Alex Earl here, and it's Hump Day with Dr. Alex Earl. This is the time I get to spend with you guys and answer all your plastic surgery questions. And of course, any plastic surgery topic is open to discussion. We can talk about the procedures themselves. We can talk about complications, which not a lot of people talk about. We can talk about pre-op, post-op care, etc. Okay? And pretty much any procedure from head to toe. All right? But of course, as you all know, I usually like to kick it off with a little discussion about something, a hot topic, something that's going on right now in the plastic surgery world. And today, I want to talk about something that we've been hearing about a lot. There's been a lot of interest in this, especially lately. And so what I'm talking about here today is what we call, or what is called, I guess I should say, the Skinny BBL. So we've been getting a ton of people from TikTok, Instagram, all kind of blowing up our DMs about the Skinny BBL and, am I a candidate? What's the difference between the regular BBL, et cetera, et cetera. So I just want to break it down here for you guys so everyone has a good understanding of what we mean when we say a Skinny BBL, all right? And so I think there's really two major differences between your skinny BBL and, quote unquote, your kind of run-of-the-mill BBL, all right? And number one is who is a candidate, so who is it for? And number two is like the style or the aesthetic of the procedure, okay? And I think those are the two major differences. So number one, who is a candidate? Well, these are typically for patients that are gonna be a bit lower on that BMI range, okay? So we're talking about patients that are gonna be in that BMI of about, here we go, of about 21 to 24, okay? So it is kind of a small range there, but anyone who has a BMI less than 21, usually you don't have enough fat on you to perform a BBL. Having said that, if you're like around that edge, please send in your information because I have been able to do it in some patients, not all, but in some subset of patients that have a BMI of 20 and even 19. But again, that's gonna, it deserves an evaluation, and then I may or may not ask you to then gain some weight. So that's definitely a possibility. But if your BMI is kind of on the edge there, go ahead and send us your questionnaire, your photos, so that I can make an evaluation and make my best recommendations, okay? And then again, typically it's up to about 24. Once you start getting into like between the 25 and 30 range, then you have a lot more fat and not necessarily considered a skinny BBL, and that would be more kind of just our regular BBL, okay? And then the second thing is the look that we're going for. And of course, part of the look is because it is the aesthetic today and what a lot of people are looking for. And part of it is because we're just not gonna have a ton of fat, right? So for the skinny BBLs, our limit here in Florida as how much fat we can remove is 4 liters. But typically our skinny BBL patients, for a lot of them, we're not going to be able to remove 4 liters, right? They just don't have that much available fat in their bodies. And so we're going to be removing somewhere between 2 to 3 liters probably on the average, okay? And so what are we looking for? We're looking for a more, what I like to call an enhanced natural or athletic look, all right? So we're not looking for like this, like the very like super wide hips or lats or shelf booties. We're looking more for enhanced natural looks, maybe just filling in the hip dips, a little bit more projection, maybe a slopey, pokey slope, I should say, and just keeping kind of that Pilates body, that athletic look, that enhanced natural look, and not going for those Vixen looks, okay? So those are the two, I think, main differences between the skinny BBL versus your regular BBL, okay? And I've been doing this for a while, and we actually have I have my own signature skinny BBL, which it's actually trademarked. I like to call it the South Beach butt lift, right? Because we're not in Brazil anymore. We're here in Miami. We're here in South Beach. So I have my very own trademark procedure, which is a South Beach butt lift, and which is a skinny BBL to start, but I'm doing it with minimal incisions. So I'm decreasing the number of incisions, and they're being placed very well hidden in areas that are not going to be seen, even if you're wearing like a tiny 2-piece bikini out on the beach, right? And that's really the goal. Between the fact that you can't see the incisions and that we're going for that enhanced natural athletic look, the goal is that we're going to keep people guessing. Nobody's going to know whether you had a skinny BBL or not, but what they are gonna say is like, they're gonna be like, I don't know if she had one or not, but she looks fantastic, right? And that's really the goal that we're going for. So we're hiding the incisions, we're minimizing the incisions, and we're creating those beautiful, smooth transitions, right? And so it comes with my Earl curve, so it comes a little bit with my signature style, which is the Earl curve, as well as my signature upside down heart shape from the back, okay? So that's my signature style there. And what I do is I make sure that all the transitions are very, very smooth. So as we come in to the waist and then down out to the hips and then down to the thighs, that's a nice smooth transition. It's tailored to your own underlying frame, okay? So that we can make sure that it's a beautiful, enhanced, natural look that'll keep people guessing, okay? And then of course, like I do for all my BBLs, but certainly for this as well, 100% of the time, I do everything under ultrasound guidance. That is the safe way to do a BBL. And that's why I call it a skinny, safe BBL with ultrasound guidance, okay? And what does that do? Well, that turns a blind procedure into one where you can actually see. And the ultrasound helps me see exactly where the cannula, the device that I'm using to put the fat, I can make sure that it's in that safe space, okay? What is the safe space? It is the space between the skin and the muscle, right? You don't want to be in the muscle or deep to the muscle. That's where you run into problems, big problems, and fat embolisms and death, right? So you want to keep it between the skin and the muscle, and the only way to make sure that you're doing that is to actually see it with the use of the ultrasound. And so I'm a pioneer in this technique. Been doing it since 2019 and have over 2,000 ultrasound guided BBLs under my belt. Okay, and I've never had a single case of fat embolism or death. Okay, so all BBLs should be done with ultrasound guidance. And then of course we fix those hip dips. Okay, and I want to delve into that a little bit because huge controversy now, right? People out there, you know, I put up a sign and I said, exercise will never fix your hip dip, okay? Because there is no muscle there, all right? There is no muscle in that area. If you're gonna look at the anatomical name for that area, kind of the technical name, it's called the trochanteric depression. That area where the hip dips in is called the trochanteric depression. And in that trochanteric depression, there is no muscle. What it is where it's the tendons of the muscle as they move in and they insert into the bone, okay, which is called the greater trochanter, okay? And so there's only tendons there, and then above the tendons is, of course, a variable degree of fat, and then, of course, your skin. And so if you have very little fat between those tendons and the skin, you're gonna have a hip dip. And of course, a lot of this can be genetic, right? There's people that are naturally born with more fat in that area, and so they have, either less of a hip dip or no hip dip. And there's people that are born naturally with less fat to the area. But what I can tell you, and some people obviously say, I love my hip dip, and that's great. If you love your hip dip, that's awesome. There's nothing that needs to be done. But guess what? There's a ton of people that don't love them. They love the way that they look in the dress with a nice hourglass shape. Or that beautiful upside down heart shape from the back. And so they want to, quote unquote, fix or improve the hip dip area. And you cannot do that with exercise because there's no muscle there to grow, right? Exercise will build muscle, and you can certainly build a glute in terms of projection. The glute you can build, but the hip dip area has no muscle to build. So what does it need? It needs volume. And the best volume is your own fat. Now, if you're super skinny, those that are BMI 19 or 20, and you have no fat, well, we have one other option that we can use to fill in that hip dip, which is using somebody else's fat, right? You guys remember me talking about alloclay? That's the structural off-the-shelf fat that I can use that I can take off the shelf and use to fix your hip dip. And I can do it under local with no liposuction, and it's basically you're in, you're out. It's done under local with minimal to no downtime, which is a good option for those that are really low on the BMI scale and they still want to fix their hip dip. Okay, so can exercise fix your hip dip? No, it cannot. And I don't know why some people say that it can. I've never seen it. Anatomically, doesn't make sense. It just can't do it. You gotta fill it, and you need a filler, and the best filler is your own fat. Okay? All right. Now, so what is included in a South Beach butt lift or skinny BBL? Well, you're certainly gonna be including your liposculpture 360, And I would just say liposuction. We're not just like sucking away fat. We're creating shape. That's why it's called liposculpture. So we'll be doing liposculpture 360 all the way around. So that's your whole abdomen, flanks, waist, pretty much the entire back. Okay. For me, us here at Pure Plastic Surgery, it's going to include Vaser, okay, as well. Vaser is a machine that helps me emulsify or knock off the fat cells from the surrounding tissue so I can remove more fat with less bleeding, less inflammation, and better skin retraction. So that's going to be included. And of course, the fat transfer to the buttock or hips. Now, there are certain things that we can add on to the procedure if you want to do it, okay? So for those of you that really want that really athletic look, then we can add what we call HD or high definition. So we can do a high definition liposculpture and we can etch out your abs, we can etch out your obliques. If you're a guy, we can etch out your chest, your biceps, all of the muscles basically, your triceps, your deltoids. We can do a whole bunch of things to really bring those muscles out, okay? So high definition is definitely an add-on that we can put on there. We can add other areas, so if you're looking into defining better the chin, the arms, the thighs, that can be added on. And of course, new, boom, what is new this year here at Pure? Rib remodeling. I know another great subject, a little bit controversial subject because people don't understand what we're doing nowadays. It's not what has been done in the past. This is like new technology, minimally invasive way of remodeling the ribs. So we're not removing ribs, we're just changing the shape of the ribs to bring in the waist. And you can certainly add rib remodel, okay, to your Skinny BBL. And it's a great add-on because before that, sometimes it was hard to really bring in the waist in our thinner patients because there wasn't so much fat there to bring in, right? And once we get to that muscle layer, that's as far as we can go. But now we can actually change the structure by changing the shape of the ribs to really bring in that waist and create a nice and significantly smaller waist for you. So that's a great add-on that we have there now. And then of course, skin tightening, right? So you have some looseness or laxity to the skin. Now we have some great options for that. We can use the body type, which we've done for years and years, but now we also have the newest technology, the newest device, the Aeon device that has the J plasma, okay, which can tighten the skin up to about 60%, which is quite significant. Doing that without having to do a tummy tuck on you. All right, so. That is, I think that's a ton of information, but I'm sure you guys have questions, and you can ask me whether it's about this or any other topic. I'm happy to answer.
Lots of questions. First question.
All right, let them roll.
Dr. Earl, what's the exact BMI for the rib remodel surgery?
Great. So actually, the good news is that it happens to be very similar to the Skinny BBL BMI. So it's going to be, BMI of 24 or less. The only difference is that there's actually no lower limit. It can be, if you have a BMI of 19, 20, whatever, it doesn't matter for rib remodeling, right? So it's going to be anything BMI 24 or less.
How long do I have to wait after a C-section to be able to have a surgery with you?
Great question. So we get this a lot, and so after C-section, you're going to want to wait a minimum of 6 months, okay? Why do you need 6 months? Because your body has to kind of readjust to everything, right? And we want everything to kind of settle in before then we start making changes, because we would hate to make a change and the body still changes and then you don't get the result that you want. So we want to wait a minimum of 6 months after giving birth or a C-section.
Does reverse BBL cause loose skin? If so, what do you do after?
Great question. And the answer is, for some people, it certainly can. Right? If we're doing a significant reduction, it is possible that the skin might remain loose. And so what do? So right now, a great option is to add Vaser and J plasma to that. Okay? So we can do a BBL reversal, reduce the hips and the buttock, but also add the J plasma and the Vaser to help with the skin tightening as well. Now, if it's something super severe, which I really haven't seen, but just so you know, if it becomes severe loose skin, sometimes we have to do a skin resection surgery, like a surgical buttock lift.
Can I do a Skinny BBL with a 20 BMI?
So like I said, if you have a 20 BMI, you're kind of right on the edge there, and what I would recommend is, yes, certainly send in your information, send in your questionnaire and your photos, so I can do an evaluation and see if you're a candidate or if I'm going to recommend that you gain a little weight. But it certainly is possible. So I think you should just send your evaluation, and that way I can take a look and make my best recommendation for you to try to obtain the results that you want.
So this is a two-part question.
Okay.
Just interested in the Skinny BBL.
Yes.
The question is, how many days do I have to stay in Miami after the surgery, and what other things do I need to purchase?
Great question. So a lot of our patients are from out of town. I get this question all the time. Where are you located? Where are you located? Yes, I am in Miami, but about 90% of my patients come from different states and different countries, okay? So we're totally geared and equipped for the out-of-state patient. We provide virtual consultations at zero cost, okay? And how long do you have to stay here? You're gonna be here for about a week in total, because you're gonna have your pre-op day, then you're gonna have surgery day, and then you have to be here for a minimum of 5 days post-op, okay? And then the second part of the question, what do you need to do to prepare? That's gonna be a long list, but what I want you to know is that if you book with us, we have all of that like specifically spelled out for you. We have a list of everything that you're gonna need. We even have one of those like Amazon kind of pure plastic surgery Amazon stores where we can send you to purchase a lot of stuff that you need. Basically, what I'm trying to tell you is that we're gonna hold your hand every step of the way. We're gonna make sure that you have everything that you absolutely need to get the procedure, all the way from supplies to massage to places to stay. To post-op cares, and even transportation. Okay, so if you want us to take care of everything, it's something that we can do.
Can I combine the rib remodel surgery with a BBL or a breast lift with implants?
Yes, so you can certainly do that. So the one thing I don't combine is the BBL and the breast lift with implants. Okay, but yes, you can combine rib remodel with either the BBL or the breast surgery.
Can I get a skinny BBL with a breast lift?
So I just answered that, right? So I typically don't combine those procedures. I'll tell you why. So here in Florida, we do have some rules that are given to us by the Florida Department of State. And one of those rules is that when you're doing a surgical procedure such as a breast lift, we get very limited as to how much fat we can remove via liposuction, which is 1,000 cc's. Now, if you're a skinny BBL, so maybe you're here, maybe your BMI is 21, right? And then I could consider it. I can consider combining the breast case with the BBL. But if I think that I'm going to be getting a whole lot more fat than that, I don't want to limit myself because I want to give you the best results, right? And so in those particular cases, I may have to separate out the procedures. I think if you're kind of on the edge there, again, I would recommend sending in your evaluation, your questionnaire, and your photos so that I can take a look at everything and then make my best recommendation.
What's your opinion about liposuction combined with Renuvion J plasma?
I think that is a beautiful combination. All right, so yes, certainly you want to be combining, you can combine either BBL or just LipoSculpture 360. And if you need some additional skin tightening, we can then combine that with the Renuvion J plasma. And that we can do to, especially the larger areas like the abdomen and the back, are great areas to do that combination. And just so you know, on top of that, I also do add the Vaser. So you're getting all three, right? You're getting the LipoSculpture 360, the Vaser, and the J plasma to the areas that you need a little bit more skin tightening for.
Can you do fat transfer to the breasts?
Yes, so it can certainly be done. And there are surgeons here at Pure Plastic Surgery that have more experience with that procedure. So Dr. Wigriff, Dr. Vidal are great at the fat transfer to the breast. So if you are considering that, yeah, certainly we can take care of you. And you may, be recommended that you see Dr. Vidal or Dr. Wigriff for that fat transfer to the breast procedure.
Can we look up your medical license in the state of Florida?
For sure, look it up right now. Not only that, actually, please go one step further. You should do that for me and for any surgeon that you're considering for plastic surgery. You should go to the American Board of Plastic Surgery. Okay, American Board of Plastic Surgery, and there's going to be an area there that says for patients, and there you can look up whether your surgeon is actually board certified by the American Board of Plastic Surgery, which is really the only board that matters when it comes to plastic and cosmetic surgery. Okay, so yes, please look me up. Please look up my license. Please look up my boards. Look everything up. Okay, and I highly encourage you to do that about me, and I highly encourage you to do that about any surgeon you're considering.
Where can I find your quotes or get a price range?
So you can get that from the website, okay? So the first thing you have to do is go to our website, which is www.pureplasticsurgery.com, okay? And I'll put that up here. So www.pureplasticsurgery.com. Okay, and that you're gonna find a button there that says start your journey or virtual consultation, and that's gonna allow you to then send your demographic information, fill out a questionnaire, send your photos if you do the entire virtual consultation, and then you'll get a call from one of our patient care coordinators who's gonna be able to answer all your questions, give you the pricing, give you the quotes, give you the open surgery dates, and just anything else that you might need.
Can you talk about the advantages to lipo and fat transfer as opposed to AirSculpt, ProSculpt, or Sonobello?
Yes. AirSculpt, ProSculpt, Sonobello don't work. So the advantage is that liposculpture and fat transfer actually works, okay? All those other things, including CoolSculpt as well, they have minimal to no changes, okay? And honestly, I don't recommend them. If they were good, I would do it here. I don't. I think if you're really looking for a visible change, something that you can appreciate, something that's going to get you to your goal, then you have to look into true power-assisted liposuction and fat transfer.
Can I go back and get skin tightening 4 years after lipo?
Yeah, you certainly can. Okay. Again, can you do it? The answer is yes. Do you need an evaluation? The answer is yes, right? We've got to determine just how loose the skin is. Because if the skin is, say, mild to moderate, then we can use some of these technologies with the Vaser, the BodyTite, or the J-Plasma. However, if the skin is very loose, significantly loose, and especially if there's issues with the muscle, like muscle separation or weak muscles, then we have to consider a tummy tuck.
Thank you. What's the highest blood pressure you accept for a BBL patient with 24 BMI?
24 BMI is a great BMI, so that's already starting very, very well. And so, all we need to know is that your blood pressure is well controlled, right? And how do we know that? Well, we got to make sure that you're on your blood pressure medications and that you have a clearance letter from your primary care provider, right? And so as long as you get that clearance letter, so you're medically cleared by your primary care doctor, and we make sure that you're on your meds and everything else, then you're probably going to be able to be cleared for the surgery. And sometimes when you come here and you're about to get surgery and you're all nervous and stuff like that, sometimes the blood pressure goes a little bit higher, but that's okay. We understand that. We take it into consideration, right? So the important thing is to make sure that you're cleared by your primary care doctor and that your blood pressure under normal circumstances is controlled.
I'm a BMI 21.
Yes.
Can I have a BBL with the off-the-shelf fat with no lipo and combine that with a breast aug?
Okay, so that would be an interesting combination, which definitely can be done. So we can do a breast augmentation and the alloclay, right? So that's exactly what you're referring to. So the off-the-shelf structural fat. And so we can use the alloclay to, of course, build the buttock or build the kicks, and then, of course, the breast augmentation. Now, if we're going to do it all at the same time, it's going to be under general anesthesia, though, right? Because I do all my breast augmentations under general anesthesia.
Can I do a BBL if I already have alloclay injections?
Yes. Okay, you want to wait till that fully, kind of settles. I typically would wait at least 3 months, right? But once everything's kind of settled and healed into place, if you have fat, I gotta think, like, why did you do the alloclay in the first place, right? But if you have fat and you have a donor site and we can do liposculpture and fat transfer, then we can do that.
Does ultrasound help avoid puncturing organs from lipo?
No. So the ultrasound helps avoid putting fat into or deep to the muscle when we do the fat transfer portion of the procedure, okay? That is the portion of the procedure where we're using the ultrasound guidance, okay? Typically, when there is a quote-unquote organ puncture, that occurs during the liposuction part of the procedure. So, how do you prevent that? You prevent that by going to a surgeon that has a ton of experience doing liposuction and that works in a safe facility and clinic, okay? So that's where you want to do your research, okay? And that's where you want to go to a place like here at Pure Plastic Surgery with myself or Dr. Vidal or Dr. Wigger, where we are all double board certified plastic surgeons, right? With tons of experience in these procedures. And I'm talking hundreds if not thousands of cases. In my particular case, thousands of cases, okay? And so that is what you have to look for when you do the research. And then you also have to look at the facility, the clinic, right? And what kind of certifications does that clinic have? And so, for example, here at Pure Plastic Surgery, we're certified by the Joint Commission, otherwise, it's also known as JCO. And that is the highest level of certification that an office-based surgery setting can get. It's basically the same people that are certifying the ORs at all the major hospitals, right? And so you want to look at that too. You want to make sure that they focus on safety first.
If you do a skinny BBL with a BMI of 25, will that be enough fat to fill the hip dips and have some left over for the glutes?
Yeah, especially if you're starting off with a BMI of 25, it usually is enough to both be able to fill in the hip dips and give you some more projection and bring out that beautiful enhanced natural shape. And so it for the most part, it shouldn't be an issue. Again, every patient's a little bit different, but if you're thinking about it, again, I recommend sending that evaluation. But yes, you should definitely, or you should be a candidate for that procedure.
Do you recommend J Plasma if you are wanting arm lipo and BBL fat transfer if you're in your 40s?
Yes. So for the arms, especially for patients in their 40s, it tends to have two issues going on for the most part. One is the excess fat, which the liposuction is going to take care of. Again, it's also more nuanced than that. It's actual liposculpture. We're actually sculpting out the arms, okay? And then the other one is the loose skin or the skin laxity. And so I like to combine both. I like to do the liposculpture to the arm combined with the J Plasma to help the skin retract so you can get the skin tighter around the arm. And of course, certainly you can combine that with your BBL for sure.
Can you correct dog ears at the same time as a BBL?
Yeah, that'll do. Like small things, like you have to make a small scar revision, a small dog ear correction, things like that. That can be done at your time of BBL with no problems without lowering that limit, from the 4 liters to the 1 liter. So it's definitely something that can be done.
How do you avoid fat embolism?
So, what did I say? You guys should know the answer to this, right?
Yep.
How do I avoid fat embolism? Okay, this is what makes us unique, right? Because we use ultrasound guidance when transferring the fat. And not only do we just use it, I am a pioneer in this technique, meaning I've been doing it since 2019, over 2,000 ultrasound guided BBLs under my belt, probably more than any other surgeon in the entire US, okay? So that's how I avoid it. I turn a blind procedure into one where I can actually see where my cannula, my device that I'm using to place the fat, I can actually see it and I can make sure that I'm in that safe space, which is the space between the skin and the gluteal muscle.
Are your virtual consultations, do they come with a fee?
So the virtual consultation is $0, no fee, okay? And that's the one that you can do through the website that I mentioned up there, okay? And so you can go to the website and you'll see where it says virtual consultation, and then that'll take you to where you fill out a questionnaire and send your photos, and that's gonna be no fee, okay? Now, for those of you that are watching that are like, well, maybe I actually wanna kind of speak to you or see you in person, we do have that as well, right? So we don't only do virtual consultations, we also do video consultations, and that does have a fee of $250. And we also do in-person or in-house consultations with me, and that does have a fee of $500, okay? Now, these fees though, if you book the surgery, they go towards the surgery. So you're not, quote unquote, losing that money. That money is going towards your surgery, okay? So it's not additional monies.
All right, last question. We're already at 30 minutes. That was quick.
Oh man, it's been a great session today. I love these questions. Please Keep them coming.
Yes, we have a lot still. If they're, I'm sure you don't have the time to be here for all day. But, all right, last question. So
All right.
you say you have a lot of inquiries for skinny BBLs. If
Yes.
you have a patient that comes in and asks for a big shelf Vixen look, can you still perform that?
We can certainly perform that. Again, I don't do cookie cutter surgery, right? I do surgery that is tailored to what the patient wants, but then also based in your underlying foundation, right? We have two things here. We gotta know what you want, and we also gotta make sure that it's realistic based on your foundation, right? Like just, for example, how much fat is available? How far is your skin gonna stretch, right? All these things. So certainly we can tailor to a more of a kind of voluptuous or vixen look. And so then what then becomes rate limiting steps? Usually if if you're too low on the BMI scale, you may not have enough fat to achieve that look in one round. You may need more than one round, right? But if you're higher in the BMI scale, say 25 to 30, you typically will have enough fat. So then what becomes a rate limiting step is how far your skin will stretch, right? Because the skin can stretch, but eventually gets to a point where it just won't physically expand anymore, right? And that's basically your body telling me, hey, Dr. O, like, this is as far as we can go. So again, it can be done, and again, in certain cases, it may require more than one round.
Thank you very much.
Okay, all right, everybody, that was a great session. I love the questions. Keep that fire going. Remember, I'm here every Wednesday on Hump Day with Dr. Alex Earl, somewhere around 4:30 p.m. Okay? All right, well, I look forward to seeing you all next week. Ciao.